Follow-up care. After your treatment has finished, you may need regular checkups so that your doctor can check your health and well-being. How often you see your specialist depends on the type of cancer and treatment you had, plus any side effects you are experiencing. It is usually different for each person. With some cancers, there is no evidence that regular follow-up tests lead to better survival. If you have any questions about why you are having particular tests, or no tests at all, discuss these with your doctor. It's a good idea to ask your oncologist or other cancer specialist for a written summary of your cancer type, treatment, and follow-up care. Share this summary with your GP or any new healthcare providers you see. It helps guide them for your care when you finish treatment. This summary should include the following information: type of cancer, date of diagnosis, diagnostic tests performed and results, pathology results, how far the cancer has spread, its grade, the hormonal status, usually for people with breast cancer, and information about any blood tests that might suggest cancer in the body. Treatment details, for example, type of surgeries, where and how much radiation therapy you had, names and doses of chemotherapy and all other drugs, results of scans and X-rays. List of symptoms to watch for and possible long-term side effects of treatment. Contact information for health professionals involved in your treatment and follow-up care. During checkups, your doctor will see how you're recovering, ask how you're feeling and coping with life after cancer, monitor and treat any ongoing side effects, look for any signs that the cancer may be coming back, investigate any new symptoms, ask if you have any concerns, discuss your general health and suggest things you can do to keep yourself healthy, such as diet and exercise. Blood tests and scans may be taken depending on the cancer type and treatment. For example, women treated for breast cancer need mammograms, and men treated for prostate cancer need PSA tests. You may not need tests. In some circumstances, research studies have shown that doing regular tests does not help find cancer. The tests are not always accurate, and they can have side effects. Being honest with your doctors will help them manage any symptoms that are bothering you. For instance, you should let them know if you feel very low in mood or energy. It is also important to let them know if you're using any other therapies, such as taking herbs or vitamins, on a special diet, or having acupuncture, for example. It is important to ask your doctor questions about anything you do not understand. Sometimes this can be hard. Doctors can be very busy, and sometimes you may not know which questions to ask. It can help to write down questions before you visit. It is a good idea to take someone with you to your appointments. They can ask questions or write notes about what the doctor says. These could include: how often are checkups required? How often you have checkups depends on the type of cancer you have. Some people have checkups every 3 to 6 months for the first few years after treatment, then less frequently thereafter. Talk to your doctors about what to expect. Sometimes your GP, local doctor, can do the follow-up. Your GP will be important to manage any other issues anyway. If you need reassurance, you can visit your GP in between visits to talk about any concerns. It may help to find and go to the same GP that you are happy with, rather than going to many different ones. In this way, your GP will be across your overall health and will be aware of your history. It may also help to book a longer consultation so that you do not feel rushed. Your GP will also be able to refer you to some health services that are free or come at very little cost to you. For further information and support, call Cancer Cancel on 131120.